Good evening. It is the biggest economic development project in Northeast Indiana since the construction of Allen County's GM plant in the 1980s.
The $536 million project is years in the making, and now the opening of the new Parkview Regional Medical Center is less than a month away. Well-being reporter Alyssa Ivinson's been watching this incredible expansion since the groundbreaking in 2008. In a NewsChannel 15 special report, Operation Transplant, she uncovers what the big move north could mean for you and the local economy.
That's right. We've been reporting on the Parkview Regional Medical Center's progress for years. Tonight, we have an exclusive first look inside at some of the new technology. It is a brand new building with lots of bells and whistles. But what I discovered is that to the area around it, this big development is much more than a new hospital.
It's designed for efficiency. It's designed to be very, very cost effective, and it's designed for future growth.
After more than 5 years of planning and 4 years of construction, the Parkview Regional Medical Center is just weeks away from opening. March 17th, the first patient will be brought in.
They're going to see an environment that is designed for comfort and calm and confidence.
The hospital is also integrating new technology into patient care through low radiation CT scanners and hybrid surgical and cath lab suites. Smart beds detect if a patient is out of position. Smart rooms offer GPS nurse tracking systems.
The nurse isn't in the room, a message goes immediately to her iPhone. But it also, if there's another nurse who is closer to that patient room than that patient's nurse, it will also go to that other nurse.
Each of the 446 patient rooms also has a lift over the bed to move patients more safely. NewsChannel 15 got an exclusive first look at the 22 tug robots roaming the halls, delivering medications and supplies to nursing stations.
The facility here is designed around best care practices from around the country. It's designed by our clinicians. It's designed around the needs of our patients.
Non-patients can browse the more than 700 pieces of artwork, many by local artists, or just come to eat.
Our dining room is right off the front lobby, and it's going to have an excellent menu of very, very healthy entrees, and we expect people will come here for dinner.
The Parkview Regional Medical Center is expected to bring in around 4,000 more cars to the area per day. But for businesses right across the street, that's good news.
With the extra traffic, it will make us more aware of those people who are coming in, and also the people who live in this area who just weren't aware of Carmike Cinemas.
The movie theater says any extra exposure can lead to more business.
People who are coming in from out of town, and even local people who are visiting folks at the hospital and who need a reprieve, a break.
A similar story a few doors down at Culver's, which already has an annual fundraising partnership with Parkview. For the burger and ice cream joint, the Parkview expansion is good news.
I think it helps in all different aspects, from workers to the services that they provide. We also get a lot of traffic from the highway itself as it is right now, and adding to that a little bit I think is nice for everyone.
For everyone but those who might be stuck in traffic from all those extra cars, the Indiana Department of Transportation is already on top of that.
We have been preparing for this very moment.
Construction on a new roundabout entrance at I-69 in Union Chapel starts next month. Parkview paid $10 of the $13.9 million price tag, which helped the project move ahead quickly. While it won't be done by Parkview's grand opening, it is part of the plan to relieve extra traffic, which was already increasing before the medical center.
The growth is so great in this northern part of Allen County that this is one way to efficiently treat the traffic.
It's that growth that IPFW professor Karen Leonard says probably helped Parkview decide to expand north. Leonard worked in the healthcare industry for 2 decades and advised other hospitals on where to build.
Out where they've moved, there are hotels and restaurants and facilities for people who need to come and stay.
Things Leonard says the current Randalia location lacks. But one thing that campus does have, bus access. The new medical center is outside city limits, so CityLink does not stop there.
My biggest concern with their move is transportation. We have some family members that need to use public transportation to get there, and that's going to be a concern.
Parkview is already working on a permanent plan with CityLink, possibly a shuttle service from the Randalia campus up north. In the meantime, patients can take the bus to the Burger King across the street from the new medical center, and Parkview security will pick them up. Leonard says it's hard to say the medical center is responsible for what future economic development may move to that area, but
Do people like to live near where they work? That's where I see part of the economic impact may be.
Mark Heisey from Parkview added plans for future hospital growth will keep helping the economy. More than 3,600 workers already spent more than 3 million man-hours building the medical center.
It's not uncommon at all for me to walk through the building and have someone from the construction team, come to me and thank me for what Parkview is doing to provide the jobs.
A huge project, a huge move that's helping move the city forward.
I think it's a good move. I think it's a wise move, and I think it's good for all of Fort Wayne on the whole.
Check out today's News Sentinel for a view of the new medical center from the air. Head to Wayne.com for more about the services offered at the medical center. And what about that hospital on Randalia? Tomorrow we turn our focus there and discover that while some services are staying, many more new ones are moving in. Operation Transplant continues tomorrow at 6. In Studio 15, Alyssa Ivinson, News Channel 15.